in situations of risk and humanitarian emergencies, including conflicts. Before we officially begin, I would just like to go through a few ground rules and logistics. As you can see, we have pinned the sign language interpreters. So everyone should be able to see the sign language interpreters. And then if you would like to use closed captioning, kindly please click on the closed caption at the bottom of your screen. And there's also an option for you to increase your subtitles, the size of your subtitles. And then in order to ask questions, just take a note that we do have a question and answer session towards the end of the webinar. And there are 3 ways in which you can ask a question. The first is to type a question in the chat box. The second is that you're able to raise your hand and we will give you an opportunity to unmute and speak. And then the third way is to type your question in the Q&A box. And just a few accessibility tips. Always remember to introduce yourself before speaking. So I am Sabiha. I'm a researcher at the Center for Human Rights and a member of the Global Coalition on Deinstitutionalisation. And this is just a tip for all our speakers and also for our participants to please speak at a pace that is moderate to allow for accurate interpretation and also for the benefit of understanding for those who are not mother tongue English speakers. Kindly please also avoid using jargon, acronyms, as well as any harmful or derogatory terms. Please also use plain language, which is clear and understandable. Be respectful of each other's time and keep your microphone muted at all times so as to ensure that there is no background noise. Now, just to give a bit of a background on this webinar, this is the 4th webinar in a series that is being organized by the Global Coalition on Deinstitutionalisation, and it focuses on Chapter 8 of the Guidelines on Deinstitutionalisation. As I did mention, the theme of this webinar is emergency deinstitutionalization of persons with disabilities in situations of risk and humanitarian emergencies, including conflicts. And this theme is increasingly of vital importance because of the current geopolitical context, the COVID-19 pandemic, as well as the deepening climate crisis. During situations of risk and humanitarian emergencies, persons with disabilities are often at an increased risk of human rights abuses in institutions, and those that are not in institutions are at risk of being placed into institutions. The guidelines on deinstitutionalization recommend and strongly recommend that during times of emergency and humanitarian crisis, deinstitutionalization should be accelerated and not halted. And now, without any further delay, I would like to introduce our first speaker of the day, Yusuf Hamdouna. Yusuf works with EducAid for the Palestine Country Office. Yusuf, please go ahead. Yes, we can see you. You can unmute and continue. Thank you.
Yeah, thank you. Thank you very much to give me this opportunity to be with you in this very important webinar, and also special thanks for you to let me to bring the voice of the people of Gaza here with you. I am Yusuf Hamdouna, and Gaza area manager for the Italian NGO EducAid. EducAid has been working in Palestine since more than 20 years, and in the last 5 years we were able to establish the Independent Living Center for persons with disabilities in the Gaza Strip. Of course, it's very, very difficult and challenging to speak about rights of persons with disabilities in light of what is happening now in the Gaza Strip and in Palestine in general. Actually, also creating this independent living center was not really easy. Because we are speaking about a very, very complicated context. As you know, the Gaza Strip is under blockade over land, sea, and airspace imposed by Israel since more than 17 years, actually. And this situation, of course, influence all the aspects of the life for the entire population of the person of the Gaza Strip. But mainly for those with disabilities, the situation, of course, become always worse and worse. So we are speaking about a very challenging context. According to Ministry of Social Affairs, Palestinian Ministry of Social Affairs, and the last statistics published by them in 2022, approximately there were 130,000 people with disabilities in the Gaza Strip, which means a very high percentage comparing the entire population of the Gaza Strip. Actually, it's really difficult. I was saying that establishing and creating this center, independent living center in Gaza, was not easy. Rights, especially I would refer to Article 19 of the United Nations Convention on persons with disabilities, rights of persons with disabilities, was speaking about living independently and being included in the community. Speaking about this in a context, a very hard context, that like the Gaza Strip, where all the rights are violated by Israel, it makes our job more challenging, actually. So let me introduce you this center, which have been established through a project that I have the honor to lead as a project manager in the Gaza Strip. That project was funded by Italian government. Actually, the establishment of this center came after an emancipatory research, which has been led by Educate, that was performed by persons with disabilities from the Gaza Strip. That emancipatory research was aiming to identify the...
Katerina, are you with us?
Yes, I am. I'm here.
Great. Katerina will be presenting on institutionalization as a circumstance that contributed to the deportation and forcible transfer of persons with disabilities from Ukraine. Katerina Reshevska is a legal expert at the Regional Center for Human Rights. She is a PhD fellow at the Institute of International Relations at the Taras Shevchenko National University of Kyiv, and she is a member of the Interdepartmental Commission on the Application and Implementation of International Humanitarian Law in Ukraine. Katerina, over to you. Please proceed.
Thank you so much, and thank you for invitation. For all Ukrainians, as for today, it's really important to have such a floor and to tell the truth about an ongoing armed aggression of the Russian Federation against Ukraine. And in this armed aggression, people with disabilities are in an extremely vulnerable situation. But why? Before the full-scale invasion, in the network of more than 750 institutions, orphanages or boarding schools, there were more than 105,000 Ukrainian children. Among these children, more than 100,000, half were children with disabilities. It was the main reason why children were in such an institutions. And the other reason was that mostly these children were so-called social orphans, and their parents were just unable to take care under them, to support these children. They lack permanent housing, begging, they have addiction to drugs or alcohol, who just were forced to work somewhere. For example, they have their jobs in other cities of Ukraine, so they leave their children in boarding institutions for 5 days of the week, and then weekend was spent with their kids. So it was in our practice before the full-scale invasion, and this is an explanation. This the highest level in Europe of deinstitutionalization was an explanation why so many children were deported by the Russian Federation. As for today, the number of deported children is more than 19,546. And as I have already mentioned, the half of them may have some kind of disabilities. When we are talking about the vulnerable position of these children, the reason is also that the Russian Federation is creating additional obstacles for repatriation of these children, and their repatriation, the whole process is very difficult because these children need sometimes special transport, sometimes they need medical support during the whole trip, and this trip may take more than 2 weeks. So it's too long, and sometimes it provoked even some troubles. We had one case where a girl from Kherson boarding institution, she was under 5 years old, and her mother went to the territory of the Russian Federation. She took her girl home, but unfortunately, after several weeks, this girl died because health state. So it was in Ukraine, but also there were elderly people and adults with disabilities in closed institutions. Due to the institutions for such individuals remain under constant threat of deportation. These institutions are now in occupied territories, and we know that Russian agents carried out deportation of these people. Then these people were subjected to inhuman treatment. Conditions of their stay in Russia were really awful in these conditions guaranteed by Ukraine. And we documented one case where Russians deported a group of 5 disabled individuals aged 20 to 35 years from Kakhovka to Voronezh. Voronezh is situated in Russia. Ukrainian passports of these people were just destroyed, and they received Russian passports. They were also limited in possibilities to leave this institution, to contact their relatives, to inform their relatives about their current place of stay. And that is why these people were just unreasonably delayed in repatriation because of the violation of their right for family reunification. And this story with destroying Ukrainian documents, with the issuance of Russian documents is very popular also for Ukrainian children from boarding institutions. But for these children, the case is also that after receiving Russian documents, they are included into the unified database of children orphans, and that is why they are transferred to Russian families. We documented cases where Russians were encouraged by financial arguments, incentives, but also by other arguments. They were supported. They were told that Ukrainian children, even with disabilities, are better than Russian children, and this is some kind of discrimination of Russian children already. The main idea was just to deport as many children from Ukraine as possible. That is why they just didn't care about means to achieve this goal. And we documented one case of the woman from Novosibirsk. Novosibirsk is the city situated in Russia, far from the place of birth of Ukrainian children, several thousand of kilometers. And this woman, before the large-scale invasion, finished the process of adopting the Russian child, but then she was called by Russian guardianship authorities, and she was told that her duty to the Russian state is to foster two Ukrainian children, two Ukrainian deported children with hearing impairments. She was forced to agree. And this story about her and about these two children from Ukraine was filmed for local television. So this is not some sporadic case, this is a practice. And despite the fact that it seems to be very humanitarian story, that people are ready to foster, to adopt children with disabilities, it is not the truth, because these children have parents or other blood relatives in Ukraine, and these parents are willing and are ready to go to Russia and to bring these children back to Ukraine. But unfortunately, because of artificial obstacles, it's just impossible. And their repatriation demands additional cooperation with foreign states. For example, now we have such a cooperation with Qatar. But unfortunately, it's not systematic, and mostly more than 90% of all deported children, among them there are also children with disabilities, so they remain under the Russian control. And unfortunately, the conditions where they are, as for today, where they are situated, the conditions and the level of medical support are not enough in order to prevent the aggravation of their state of health. What does it mean for us, for Ukrainians? It means that we should reform our system of care, both for adults with disabilities, but also for children with disabilities. And we are ready to do it. This is one of the conditions for our integration to the European Union. And the European Union told us very clearly that without DI reform, it would be impossible for us to join this organization. So I hope that during next years, we would be able to achieve our main goal, the institutionalization. But the problem is that we started this reform more than 7 years ago. and now the results are not visible. So what we should do in order to change this very poor situation, who will help us? These are the main questions. As for today, all activities for not legal DI reform, but for DI reform in fact, all these efforts are realized, are implemented by Ukrainian non-governmental organizations. We are trying to support families who will take care under the children with disabilities. We are trying to support families who have adults with disabilities. We are trying to prohibit all forms of social exclusion and all forms of social isolation of these people, because it's just a violation of their rights, and Ukraine is a state member of the United Nations Convention on the Rights of the People with Disabilities. So we are trying to do our best in order to ameliorate the situation, but because of the ongoing conflict, the dynamic of change remains very, very limited. So we need some time in order to demonstrate concrete results. But I should highlight that without DI reform, it would be also impossible to to solve all problems related to this crime of deportation of adults, of children, because one of the conditions established by Russians is that all children deported from institutions should be returned to families. This is very ambitious, and Russians are really aware that their children with disabilities remain in institutions, but our children should be returned to families. This is their condition just in order to prevent the return process. But they are doing it, and we are trying to meet this condition because we would like to have our children here in Ukraine. This is very briefly about the situation with DI reform in Ukraine, about our goals and about our challenges. I am ready to answer your questions, but unfortunately I would not be able to be here after all speakers because I will have another events. You can contact me anytime you want, and I would be able to answer all your questions or just to hear from you your inputs or your comments. Thank you so much for your attention.
Thank you so much, Katharina, and apologies to you and to everyone for the interruptions. Unfortunately, it looks like our meeting has been hacked. So we've now blocked anyone else from entering. But thank you so much, Katharina. We really appreciate you joining us and sharing your knowledge and your expertise on, the very awful situation that is currently unfolding in Ukraine. Thank you, Katharina. I would now like to invite Lisbeth Brizuela, who will be presenting on the risks of people with disabilities in institutions after Hurricane Otis in Mexico. Lisbeth is the director for Mexico of Disability Rights International and has collaborated with Disability Rights International since 2016. She has contributed to carrying out different investigations, monitoring, and reports about the situation of children and people with disabilities institutionalized in Mexico and Guatemala. She has also supported empowering activists with psychosocial disabilities, especially women. Over to you, Lisbeth.
Thank you. It's a pleasure to be here. And I'm Lisbeth Brizuela. I'm from Mexico. I would like to talk about the experience of people with disabilities in institutions after the Hurricane Otis. In October last year, Hurricane Otis hit the Pacific coast of Mexico, mainly affecting the state of Guerrero, where Acapulco and other surrounding cities were devastated for a force of a Category 5 hurricane. according to media, it was breaking regional records for strength and speed and its identification. The day before the hurricane, it was a tropical storm. No one was expecting a hurricane. In just in a few hours, the hurricane completely destroyed the city. According to NASA, Otis has been the strongest hurricane even recorded in the Pacific coast of Mexico and the fastest straining strong recorded in the Northern Pacific. That means that around 25,000 families lost their homes, access to basic services, electricity, water, and other supplies. To date, we don't have the numbers of people with disabilities that were affected during the hurricane. So GRI decided to investigate what was the situation of people living in institutions after the hurricane. So we conducted a visit 3 months later, and we visited 2 private institutions and 1 public institution. And we also visited a community center for addictions and mental health services. So during our visit, unfortunately, we were able to corroborate that institutionalized people with disabilities had been segregated before, during, and after hurricane. Additionally, DRI documented the lack of community services, the lack of support of people with disabilities during the hurricane, and the lack of intentions from the state to do something to change the reality of people with disabilities. For example, in one of the private institutions we visited, it was located in a rural area. They don't have water, they have electricity, but they don't have access to other services. And we found that this institution was totally unregulated. It was isolated and deprived of basic services, and it was a very small institution. It has around 12 people with disabilities, and the youngest person was 27 years old and then go to up. So we found the conditions were awful. The odor of the institution was a mix between urine and feces. And we found the really, really unhealthy conditions in the institutions. And because of the hurricane, the trash truck from the public service didn't pass and get the trash from the institution in about a month. So we found a pile with diapers and dirty stuff in one stuff that it's really unhealthy for the people living in that institution. They don't have enough beds. People, because this area was really hot, people was sleeping on the floor on the patio because it was easier for them. We also found a man, for example, in one corner, in one room, totally isolated. He suffered an accident like in 2021, and he was just left by the community there. And because of the lack of other services, the lack of housing, the lack of health services, he was just dropped in the institution without any intention to live out of it. So what is really worried about this kind of institutions, this private and unregulated institution, is that maybe in this case, for example, in the case of this institution, the 50% of the people detained here was sent by local authorities. I mean, the Children's Protection Authorities send people here, hospitals send people here, Victim Attention Commission send people here. So that means that even with those bad conditions, the state knows what is happening and is still sending people here. What also found is the high mortality rates. From these 12 people, the director of the institution told us that four people died every year. That means the third part of the population dies in a really small institution. So we also visited other places. This is the first one is an example of a small institution, but we visited also 100 people institutionalized. And we found that these institutions are also funded by the government, like they receive money from government to keep people here. We saw people behind the bar. We saw people in humane and degrading conditions living there, and indefinite detention. People cannot leave the institution by their own free will, which constitute arbitrary detention. And around Mexico, we see these examples over and over and over. So we also visited an institution run by the government. This was really bad, hit by the hurricane, and the institution was totally destroyed. So what the government did was to place the children and people with disabilities. There were 50 girls and 9 people with disabilities in a nursing home that was adapted to be as an orphanage while they were repairing the institution. So even in an institution where it's already happening segregation, we saw that people with disabilities is more segregated than children without a disability. So in this institution, for example, we saw that the 50 girls without a disability had the access to school, had access to other extracurricular activities in the afternoon, and had the agenda part of activities. In these institutions, there was one room with 9 young adults with disabilities. These young adults stay here in these institutions because of the lack of community services that had been happening forever. And they were just isolated in the room. They didn't have access to education, access to therapy, to rehabilitation, to other activities that allows them to develop themselves in a better way. So in these institutions, we also see how people with disabilities is being more discriminating than people without disabilities. When we were visiting the institution, there was a woman with disabilities with a smallpox, and no one told us about this. So this girl was with the rest of the people with disabilities. They were not measures to give her safety or the rest of the people with disabilities of this room. So what are going to do the authorities about these institutions? What we found is they're going to rebuild the institutions. They don't have plans, no intentions to create community services for people with disabilities. There are no any actions to release people with disabilities of those 2 private institutions. And they're actually asking money to restore the facilities instead of creating services outside in the community for people with disabilities. These structural problems are exacerbated during the emergency. This is not a problem that happened because of the hurricane. This is a problem that has been happening for years. And now with the hurricane, we see that it's more intense. Even when the guidelines on deinstitutionalization says that government shouldn't invest in new institutions or rebuild institutions, that the investment should be in the community, we saw the opposite. People with disabilities will remain in institutions because if the state has no intentions to create services outside for people with disabilities. They're investing the money to rebuild the institution after the hurricane. So what we also observed was the context, what happened outside. So we saw the lack of community services and support for people with disabilities prior to the emergency and during the emergency. We also found the lack of foster care programs, the lack of community services for children, including basic services such as school. The children have to go to special education schools instead of inclusive schools. So we also visited the one community services for mental health and addictions, and the center offers basic psychotherapy services to address anxiety, depression, suicide prevention, or substance abuse. However, this center is not specialized on other issues that could be more challenging for people with disabilities. For example, they don't have attention or care for people with autism or intellectual disabilities, or for people with psychosocial disabilities. And the director of this place told us that the state has a very few psychiatrists. And if they need, for example, a consultation, they must go through telemedicine. So the events that occurs in autism also amplifies other elements in the state that it's already dangerous. Acapulco is a city that is very considered violent. Narco traffic is present here. So when we visited the city, it was all full with the military. The military was covering to avoid events with narco traffic and violence. So we also saw the lack of housing and all on how the violence increases the possibilities of people with disabilities to still lock down in institutions. So all this situation shows how there's a lack of support for people with disabilities in a state of violence, such as Acapulco. Thank you.
Thank you so much, Elizabeth. I think one thing that you mentioned that really stood out to me is when you said that there's no accurate statistics, on persons with disabilities during the hurricane. And I feel like that is such a common thread, in all climate or, any sort of emergent situation. So thank you so much for sharing that. I would now like to move on to our next presentation. And this is by Matthew Mutiso. He will be presenting on the impact of the 2024 floods on persons with disabilities in Kenya. Matthew Mutiso is the Executive Director of the Coalition Action for Preventive Mental Health in Kenya, which is a mental health ecosystem accelerator organization made up of a wide variety of community-based groups and NGOs on mental health. Matthew, please go ahead.
Thank you, Sabia. I hope you can hear me and everyone else can also hear me loud and clear.
Yes, we can. Thank you so much.
It's a pleasure being here, and I'm honored to share with you some of the reports that came out during the floods in Kenya and its effect on personal psychosocial, all disabilities, not just psychosocial and intellectual disabilities. Let me start by saying a brief painting a picture of what has transpired during that period in this country. A preamble that will give us will introduce us to the situation that occurred in terms of responses. Around May 2023, the Kenya Meteorological Department warned the country that they will be experiencing enhanced rainfall due to El Nino, and this would have happened between May to July and October, December, going towards continuing into 2024. But there was a sarcasm that happened within the political elite who looked at it from a spiritual perspective and then decided that it was an answered prayer out of the longer drought season that the country had experienced. So they played it low. And actually, the president came out around October and said that Kenya will not be experiencing El Nino as it had been predicted. But at the same time, the country, also the government, set aside, announced about $80 million to prepare for this as a disaster response nationwide. And this was an issue that is being raised up to now in terms of accountability, where the money went, because nobody knows. It's a huge amount of money. Suddenly, going towards coming into 2024, the rains were very heavy, and deaths had been started to be reported, destructions of properties, mudslides, floodings, and so on. And at this time, again, the government rushed hurriedly around April, created now a multi-agency team to manage the response. And people went out and also condemned the government in this area, how they had responded. The clergy came out, the opposition came out, and there was a need for government to be held accountable. In that, we know that in Kenya, we have various frameworks and policies that have been put in place by the government to respond to disasters. For example, the climate change response strategy, it's there. There is a climate action. There's a Climate Change Act of 2016, the Climate Action Plan of 2023, 2027. But noticeably is that the response for persons with disabilities is not well pronounced on how they should be undertaken and who should be in the lead front and so on. So there's something missing when it comes to response in terms of emergencies for persons with psychosocial and basically all disabilities. Sorry, I'm into psychosocial and intellectual disabilities because mostly that's the area that we focus on as a coalition. Moving forward is that there were some reports that came out, and this is something that perhaps I'd also conclude with, is that we also miss data that is relevant and speak mostly about institutionalization. This is an area that is not well paid attention to for the longest time, and it has been assumed that things will normally take care of themselves, or maybe it's not well understood. So there were some reports, especially from the non-state actors. If I'm allowed to quote, I'll quote the Human Rights Watch, which reports about 200,000 people in the country were displaced. There was property destroyed, infrastructure and livelihoods across the country, which exacerbated socioeconomic vulnerabilities for people generally, not specific for persons with disabilities. And Red Cross also came out, Kenya Red Cross, around the same time between October last year and February this year, and reported that about 1,781 people had died because of the floods, landslides, and especially in some specific regions like Western Kenya, Northeastern Kenya, Central Kenya, and coast regions. The media also came out and reported that the helplines that were there were unresponsive in some locations. Some other organizations like Cheshire Disability Services of Kenya mentioned that there were numerous challenges for persons with disabilities who are often overlooked in crisis mitigation, preparedness and response, even recovery efforts. And this was also supported by other organizations like TINADA in Kisumu, which is also at the moment doing a lot of psychosocial support for persons with disabilities who are affected by the floods. Let me also say that there were challenges that people went through, persons with disabilities, for example, which threatened how they live, how they are doing their things, and so on. Like persons who have vision impairments, when the roads were flooded, they became swimming pools, it became dangerous for them to move. Some people lost their wheelchairs. It was hard for other people to leave buildings, for example, if it's flooded on the floors, and because there are no ramps, and many people who lived in the downstairs of certain buildings found it very hard to live or to survive in those areas. There were statements that were issued, for example, by the United Disabled Persons of Kenya and Christian Blind Mission Global. And this, one of the key things that their statement brought out is that many of the reports that were given could not be fully confirmed. And thus, this again brings out the issue of data in that they reported some incidents in areas like Maimayu, which happens to be around Central and Rift Valley of Kenya, Turkana and Garissa, which happens to be on the north and other sides of Kenya. And what they said is clearly, which is true, some reports could not be well verified, even for persons with disabilities, how the floods had affected their life. Although in general, many people lost family members, people lost property, others lost assistive technologies, and they're in the process of even getting new ones. Others are stuck and they need support to find alternatives way of navigating their daily lives. There was a problem when it came to issues of children, also with mostly affected by the autism spectrum. Some of them needed therapy, and therapy was found in institutions that were closed. Most of the schools were converted into shelter places, and even schools reopened later on. In general, there's no cases that have been really recorded of forceful institutionalization during that period. But one peculiar incident happened that we got notice of as an organization that works around issues of psychosocial and intellectual disabilities. And this was a statement that was issued by the Minister for Interior, who happens to be the main coordinator of the response and emergency situations in the country. The minister said in his statement that persons who are risking their lives during this period, and they end up perhaps losing their lives or even attempting to help themselves from the floods and so on, they'll be caught, arrested, and jailed for attempting suicide. These are people who are trying to save their lives. These are people who are trying to save their property. As an organization, we found this to be very appalling, very disturbing, and we responded with a similar media statement and to the insensitive nature of this press release by the minister, because it's definitely insensitive to persons who have lost their lives, persons who have survived from suicide, and their loved ones. Let me, in conclusion, just highlight some challenges that I believe are in existence. Coming up to this webinar, I had to interview or to get some information from various organizations that work with persons with disabilities. And one of the issues that came out so strongly is that there's a need for enhanced capacity in understanding of the institutionalization guidelines. And we believe this is an opportunity missed in terms of de-escalating institutionalization, because we've just went back to the default mode. And this would have been a very good opportunity to close some institutions. There's a challenge when it comes to monitoring and even evaluation of the response work, basically targeting persons with disabilities, various disabilities. There's, of course, lack of the disaggregated data for persons with disability in institutions and community. Even the response lacked inclusion and necessary accommodations for persons with disabilities. I'll stop there for now, and in case there are any questions, I'll be around to respond to. And I know some persons from Kenya who work with the Organization for Disabilities have also joined this webinar, and I'm sure they'll be glad also to raise some issues that I could have missed. Thank you so much.
Thank you so much, Matthew. We really appreciate you sharing the experience of what occurred in Kenya earlier this year. Thank you for highlighting also that it was definitely a missed opportunity by the Kenyan government to actually close some institutions. So thank you so much for that, and thank you for your efforts. I would now like to invite our next speaker, Perpetua Senkoro, who will speak on violence and attacks, the situation of persons with albinism in Tanzania. Perpetua is a Tanzanian human rights advocate specializing in disability inclusion with a Master of Laws from McGill University and a Bachelor of Laws from the University of Dar es Salaam. Having served as Program Officer at the Tanzania Human Rights Defenders Coalition, she has supported organizations for persons with disabilities through capacity building and technical assistance. She has also served on several consultancy roles, including developing a policy brief on reproductive health rights for women with disabilities in Kenya, co-conducting a gender-sensitive analysis for UN Women in Tanzania, reviewing a manual for the protection and well-being of human rights defenders with disabilities for Protection International, as well as facilitating training sessions on protection and wellness needs for women human rights defenders with disabilities for East Africa. Perpetua, can you please go ahead? Thank you so much for joining us.
Thank you so much, Sabiha, for the opportunity. And thank you for all the presentations that have been given by my fellow speakers. I've already been introduced, so without further ado, I'll go straight to the presentation, and I will be speaking about the situation of persons with albinism in Tanzania with regard to violence and attacks. So quickly, what is albinism? Albinism is a genetic condition whereby one is born with little to no melanin pigmentation in their skin, their eyes, and their hair. And I'm a person with albinism. And albinism is also is considered as a disability because of the impairments that people with albinism are born with. We are born visually impaired because of the lack of melanin in our eyes, and we are also born with skin that is highly intolerant to sunburn, which causes most of us to end up having skin cancer due to prolonged exposure to the harmful rays of the sun. So when these impairments interact with barriers in the environment that we're in, whether it's school or in other areas that have barriers, that is when we identify as persons with disabilities. In Africa, the challenges that we face not only pertain to the impairments that we have, but they also stem from the way we look. We people with albinism have Caucasian skin color, and unfortunately, we stand out in African communities because, you know, the usual is taken to be brown skin or black. And then when we are seen in our communities, we look white. So this causes us to be succinct to attacks, violent attacks, including killings, mutilation of body parts, our brothers and sisters who are buried, their body parts are stolen from their graves, and different kinds of harmful practices related to the way we look, because there are perceptions in our communities that link us to witchcraft practices, that maybe if someone gets our body parts and does, you know, witchcraft rituals, they believe that they'll get good luck. If they are poor, they'll get rich, and other false beliefs that are linked to the way people with albinism look. And this has resulted to many attacks that have been reported so far in over 30 African countries, including my own, Tanzania. And the available data shows reported attacks since the year 2000. In Tanzania, to date, there have been a number of 209 reports, which include killings, mutilation of body parts, grave vandalization, some people are missing, and so forth. So in response to this situation, the Tanzania government took a lot of steps, and one of them was the establishment of temporary holding shelters. These were safe houses for people with albinism, and these were established between the years of 2008 through to 2014, 2015. And data shows that there were a total of 32 temporary holding shelters which were established by the government. And this, when these shelters were established, before people with albinism started going to those shelters, these shelters were schools, they were centers for people with disabilities. They were not designated as, you know, safe places where people with albinism could go to. So the government transformed these places and allowed people with albinism who were living in fear of attacks to go to these places for safety reasons. In the beginning, it was an action that was meant to be temporary, but since the attacks were continuing to happen year after year, the temporariness started to disappear gradually, and there were some people with albinism who went there as children, as young as 2 years old, up to young people, adults. It was a mix of ages. And some children grew up in the shelters. And there are a lot of challenges which were viewed in these shelters. Of course, there was a lot of family separation. Many people who went to these shelters left their families and began living at the shelters and making their shelters their homes. And since the shelters were not adequately prepared for catering for this situation, there were poor living conditions in the shelters. For instance, among the children, there were limited resources, including learning materials. The children could not access education in the same way as other children who were not in the shelters because of severe lack of teaching and learning materials. There are also inadequate equipment with regard to health. So the people with albinism who were residing in those shelters were found to have deteriorating health conditions due to the poor health facilities that were at the shelters. Like I said in the beginning, we are born with no melanin pigmentation in our skin, hence we are susceptible to skin cancer. So the children who were living in the shelters had no conducive environment for skin cancer prevention. So many of them were starting to show early signs of skin cancer because of the setting of the shelter, how the shelters were set. And then when the people were being taken to the shelters, there was a poor system of record keeping, including registration. So there were people who went into the shelters, their details were not filed, their details were not collected. Hence, by the time they started living there, and some of them, especially children, their families just dumped them and went away. Some even lost their identities. As they grew older, living in the shelters, and they're having their family abandon them in the shelters, some lost their identities. They wouldn't know, where their families were, where the villages where they came from because of poor record keeping. And also, it was observed that there was no clear exit strategy. When the government was designating the shelters for people with albinism for safety reasons, there was no strategy of when that would end, what measures would be taken for the people to go back into their communities. This was a lingering question throughout the years when people with albinism were residing in those shelters. In 2015, after a request from an NGO called Under the Same Sun to the African Committee of Experts on the Rights and Welfare of Children, in late 2015, the committee went to Tanzania on an investigative mission to see the situation, particularly of children with albinism in those shelters. And after getting to see how the situation was, after speaking to different stakeholders, in 2016, it published a report. And among the recommendations that were given in the report by the committee was the deinstitutionalization of those shelters. It was recommended that the government should ensure that the people with albinism are taken back to their communities, because at that time the reports of attacks were had started to go down. So in 2019, the government adopted national guidelines on children's reintegration with families, which laid down procedures to facilitate the return of children to their families. And the deinstitutionalization of the children with albinism in the temporary holding shelters was then subsequently heard about, although no formal information was shared with the public. So, and in 2021, Tanzania reported to the Universal Periodic Review Working Group that the temporary holding shelters were closed and people with albinism that were residing there were taken home. And currently, Tanzania is also in the process of approving a national action plan on albinism, which is specific measures on the institutionalization of people with albinism. However, there are still a number of lingering concerns with regards to this situation. And one of them is with regard to the process of the institutionalization itself, because it was not clear, it was not open, there is no data, how many were taken home, what is the situation of the people who were taken home, how was the process undertaken. So there are still questions with regards to this whole deinstitutionalization, on whether the process took into account the people's preparedness for a change of environment, considering their past, traumatic experiences which led them to move to the shelters in the first place, and also whether the process took into account the environment that the people were about to be taken back to, that is, from the shelters back to the community, including whether their families were ready to take them back and care for them and provide for their basic needs, and whether the safety and security situation of their home areas has indeed improved, and whether there was a follow-up plan after the process, and whether there were mechanisms which were put in place to ensure that the people are currently, well coping and cared for and protected. Also, there is inadequate data. I've heard my brother from Kenya also mentioning the same thing. We are also experiencing the same challenge of inadequate data. Although we had a census recently, population and housing, but the issue is disaggregation. So it is difficult to pinpoint who lives where, what they need, what measures have been taken to address the challenges that they're facing. And this has shown itself. For instance, this year, there have been occurrence of 2 reported attacks. In May this year, 2024, there was a machete attack on a 10-year-old boy with albinism. And then in July this year, 2024, the body of a 2-year-old girl with albinism was found mutilated. So, and when you look at these 2 attacks, the families that were affected, the boy's family and the girl's family, looking at their homes, for instance, their houses, they were not secure houses. But if there was adequate data to determine whether people with albinism are living in secure conditions, what they need, what actions are needed to be taken, regardless of whether they are located in remote areas or urban areas, then we would have been able to take action before the risk got worse for these 2 families, and along with other families which are out there that also need the same interventions, safety interventions, but we're not able to identify them and take action on time. With regards to these 2 attacks, several suspects were arrested, and there are cases in court that are ongoing. With regards to general challenges that continue to exist, there is event-oriented civil society action and government action. Currently, any action with regard to people with albinism is event-oriented. If there's a reported attack, then you see everyone talking in the media, you see campaigns, awareness-raising campaigns going on, and then suddenly things die down and it goes quiet until the next reported attack happens. This is a challenge because these actions are supposed to be continuous and not, attack-oriented or event-oriented. And among the CSOs that are working in the area of, albinism advocacy, albinism services, most of them are more interested in service provision rather than, advocacy itself, which is not bad, but service provision must go hand in hand with, policy advocacy, awareness raising, and all that. And also, other CSOs which are working on people with albinism, they are experiencing, most of them, especially local, they're experiencing structural and financial weaknesses, which impedes them from properly addressing, properly advocating for the rights and welfare of people with albinism. And also by, on the side of the government, it has political will, but it is slow. We find ourselves having to push them for them to act. Otherwise, the government stays silent for most of the time. There are also opportunities. Currently, we have an increase of people with albinism who have excelled academically and who can champion the cause. We also have an improved political space. Though the government is slow to act, but its doors are open. It is open to, dialogue, and when we go to them, they open their doors to us. They're willing to talk to us, which is an opportunity for change. But there's also continued interest from development partners. My recommendations would be for the government of Tanzania to conduct a follow-up assessment in collaboration with stakeholders with regards to the situation and needs of people with albinism recently integrated back into their communities. But I would also recommend for the government to also adopt and implement the draft National Action Plan on Albinism, which provides for specific measures for protection and rights and welfare of people with albinism in the country. That will be all. Thank you.
Thank you so much, Perpetua. I think what was really important that you mentioned was, how at first institutionalizing persons with albinism was just a temporary measure. And then, as time went on, it actually became very permanent. So thank you so much, Perpetua, for sharing with us your knowledge and your expertise. And please continue doing all the great work that you are doing. And I would now like to move on to our next presenter, who is Fatima Laher. Fatima will speak on deinstitutionalization in the context of the Life Esidimeni tragedy in South Africa. Fatima Laher is a candidate attorney at Section 27, who has been part of the team representing 44 of the deceased in the Life Esidimeni inquest. Fatima, please go ahead.
Hi, everyone. Thank you so much for having me. I'm just going to share my screen. May I please have access to be able to share my screen, if that's okay?
Yeah, sorry about that. We actually blocked that because of the hack that happened earlier. But Rita, if you could please enable that, would be appreciated.
Thank you so much. Okay. So I'm going to be speaking about deinstitutionalization through the lens of the Life Esidimeni tragedy. This tragedy has spun across 8 years so I'm going to try my best to cover as much as possible in 10 minutes. So it all started in 2015 when the MEC for Health, which is the member of the Executive Council, announced the termination of the Life Esidimeni contract. This contract catered for 2,000 chronic mental health care patients in the Life Esidimeni facility. What the termination of this contract then did was it allowed the Gauteng Department of Health to move these mental health care users into NGOs and other psychiatric hospitals in an attempt to deinstitutionalize and save costs. These NGOs were unlicensed, they were ill-equipped, and they were just not catered to take in mental health care users. This deinstitutionalization happened despite expert evidence and intervention. There were various organizations who intervened to try and stop this escalation, because what the initial plan was to deinstitutionalize by 200 beds a year. But what the MEC for Health decided was, when she terminated the contract between March and August of 2016, she moved 2,000 patients in a completely chaotic manner. This was an emergency that was man-made. It wasn't a natural emergency that required deinstitutionalization, but it was a self-inflicted emergency that had 2,000 people moved in a rather chaotic sense. These mental health care users were discharged into NGOs and hospitals around the province. This process was so chaotic that patients were loaded on the back of trucks and in the back of buses and shifted around without their confidential information. Patient records were completely lost in the process. These NGOs weren't licensed, and they lacked the proper facilities to take care of these patients. The mental health care users were not provided with the necessary medication. In some cases, because they didn't have their patient files, patients' identities were unknown, and some patients had the incorrect identities. Therefore, they were given the wrong medication. NGOs were not staffed with trained healthcare professionals. There were barely any nurses on site. There were NGOs where patients were put in and they were not monitored at all times. This led to, upon autopsy, revealing that certain patients had rubbish and various objects in their stomachs. This just shows the level of neglect of these patients. There was another NGO who was not equipped to take in adult patients, as it only had cot beds, and this resulted in adult mental health care users being placed into cot beds. I'm gonna go very briefly over the legal aspects. There was then the Ombuds report. The Ombudsman, the Health Ombud, was requested by the Minister of Health to do an investigation into the Life Esidimeni tragedy, which then resulted in the Ombud issuing a report which found that the actions of certain officials and NGO owners to be unconstitutional. The Ombud then recommended that this be put towards an arbitration. The Life Esidimeni arbitration was held in June 2017, which awarded constitutional damages to the families of the mental health care users who died in the Life Esidimeni tragedy. In 2021, we had the Life Esidimeni inquest, which then held the former the former MEC for Health and the project leader of this life Esidimeni tragedy to account and recommended them for prosecution for culpable homicide, which was a huge win because it's very seldom that you see accountability in these kinds of tragedies. So what went wrong? There was no clear lines of accountability. There was no clear job descriptions. There was a lack of a paper trail. And I think this is something that's been common through all the speakers today, is that the lack of a paper trail. And with these patients, due to their lack of documentation, lack of identity, it resulted in patients going missing. It resulted in certain patients still not being found to this day. It's resulted in misidentification of patients, therefore issuing the wrong medication to patients, and eventually resulting in death. There was also the basic needs of institutions and people were not met. So certain NGOs did not have adequate food, adequate water to provide to these patients. It wasn't an adequate facility that provide rehabilitation for these patients. And the way that these patients were moved, there was no process of rehabilitation. They were just taken and put into completely ill-equipped NGOs. Some NGO that was on top of a mountain with steps in the NGO, making them being unable to move around the NGO. And there were certain things like this. Also, certain NGOs didn't have glucose machines, blood pressure machines, or the basic resources to even monitor and ensure the health of these patients. The WHO principles that were not followed in Gauteng. So these are the principles that the WHO highlights that were not followed in this tragedy, and that's something that we can learn from. These are community-based services must be in place. For deinstitutionalization to take place, you need solid community-based services, and this was something that was not put in place. Users were moved without proper community-based services in place, and this resulted in the tragedy that unfolded. The health workforce must be committed to change. The health workforce in this case was coerced by leadership rather than being committed to the process. Political support at the highest level, highest and broadest levels is crucial. And in this case, the political leadership at provincial level was ill-informed and had questionable motivation. And the national political leadership was completely excluded from this decision-making as well. Timing is key. The process of deinstitutionalization was rushed in this case and lacked consultation. Experts obviously made input, but it was completely, it went unheard and unlistened to by political officials and officials in charge in this case. Additional financial resources are needed. Costs were cut rather than additional resources being made available. And for the institutionalization to occur and to take place, costs cannot be cut. The same amount of costing for an institution needs to be given to NGOs. Key lessons to take away for institutionalization in this event. I think first and foremost is to reduce stigma. Comprehensive anti-stigma and anti-discrimination events must form part of comprehensive deinstitutionalization process. They need to establish a comprehensive community services. Community services must be established before transfer of users from institutions, whereas in this case, community institutions weren't even established at the time of patients being moved. Certain houses were just owned by, there was an NGO whose uncle owned a house, and she had just taken that house and converted it into an NGO to house these patients. And this was one of the NGOs that occurred, one of them that lost some of the most lives. Community care is at least as expensive as institutional care. cost savings should never be a motivation for moving people into community care, and it requires the same financial resources as institutional care. Pay attention to physical health. These are in some cases our patients were, if these, in this case, it was a case of mental health care users that were moved, but to pay attention to their physical health, these were mental health care users who then ended up passing on due to bed sores and other things that resulted due to their physical health, which was completely ignored, and their basic needs not being met. Obtain consent from service users and families. The families of these mental health care users were obviously not consulted. They did not even know their loved ones were being moved to these NGOs. And in some cases, families are still looking for their loved ones to date. There was also a case of a patient having to be exhumed for the families to identify the body. This was the extent of the tragedy in this case. To set and monitor norms and standards for community care. Norms and standards for community care must be established, and proper and regular inspections must be carried out. Facilities must meet the requirements before licenses are issued. And in this case, licenses were backdated. Licenses were given to facilities that didn't meet the norms and standards or the audit list for that matter. Consult broadly, plan and implement slowly through the consultation needs to occur because deinstitutionalization is a sensitive process that requires full commitment from all stakeholders. And that's why collaborative decisions are quite important. Movement of these users require thorough planning and preparation as well as phased implementation. And I think that's something that was not done in this case. Always uphold medical ethics, because unlawful in this case, we would ensure that health officials know that unlawful instructions must be resisted. You cannot carry out unlawful instructions, which was the case in this, which was what happened in this case. Unlawful instructions were given and they were carried out by officials. Thank you. That is it from me.
Thank you so much, Fatima. That was a really great presentation. I think when you think of Life Isidimeni and the fact that it's been going on, or this is an issue, as you mentioned, that it spanned 8 years. I think for me, really shows how, our government and, governments around the world, but in this case, particularly the South African government, and, the lack of accountability and how the officials that are responsible just refuse to, accept responsibility for their actions. Thank you so much, Fatima. And I will now introduce our last speaker for today before we proceed to the Q&A. Our final speaker is Moyahabo Toka, who will present on strategic litigation to give effect to the rights of children with disabilities, a case study of the Center for Child Law versus Minister of Basic Education. Moyahabo is a legal researcher and admitted attorney of the High Court of South Africa. She joined the Center for Child Law, University of Pretoria, in 2021. The Center for Child Law, straddling both research and litigation to advance the best interests of the child in law, policy, and practice through research, advocacy, and litigation. Moyahabo, over to you.
Good afternoon, everyone. So as as my good friend Sabiha has already said, my name is Moyahabo Toka. I work as both a researcher and an attorney at the Center for Child Law. One surprising thing about this particular case that I'm going to discuss today is that it was the first case that I actually substantively dealt with when I started work here at the center during the COVID-19 pandemic. But anyway, so I'm just going to put you through it, and I think it will also be, I don't take for granted that a large number of participants are not South Africans. So I will give you some legal and legislative background so that we have a common basis of understanding regarding what the issues are, right? So in terms of our South African Constitution, in Section 9, it provides disability as one of the grounds for prohibited discrimination. So essentially, in advancing substantive equality, the Constitution recognizes that persons with disability have to be provided with equitable resources to ensure that they're able to operate on an equal level with their non-disabled counterparts, right? And then we have our Section 29 of the Constitution, which provides that everybody has the right to basic education without any conditions attached to it. And again, this was an argument that was continuously made from 1994 all the way until 2010 when it was settled, where the argument was that education for persons with disabilities has to be subject to the availability of resources. So automatically now that discriminates against children with disabilities or persons with disabilities in general, and makes it and nullifies the provisions of Section 9 that I've already provided to you. And then in the context of our work, as the Center for Child Law, we deal specifically with children. So it's an intersection of two states of being, right? Being a person with a disability as well as being a child. And we know the issues that come with those two areas. In, again, dealing with children, Section 28, subsection 2 of the Constitution of the Republic is very clear that the best interests of the child have to be considered as the paramount consideration in every matter where a child is concerned, right? So again, among the very long list of considerations to be taken into account when considering what is in the best interest of the child is the needs of the individual child. So it's a very individualizing provision. It says what Sabiha needs and what is good for Sabiha is not necessarily what Moya needs and what is good for Moya, because context will tell you what is needed by whom and what you need to provide. Okay, taken from that, right? In 2010, the Center for Child Law engaged in a case cited as the Western Cape Forum for Intellectual Disability case. And in that particular case, it was established that yes, children with disabilities have an equal right to basic education, as all children have, and it is immediately realizable. Then thus, in a South African context, it put to bed the arguments that had previously been made that the right to basic education for children with disabilities is subject to progressive realization. Taken from all of that, also South Africa adopted the white paper 6 in 2001. It has still, so, okay, in a South African context, a policy or a legal document goes from a white paper to a green paper, and then it goes through the necessary processes before it's signed into law. In this particular context, it only ever reached the stage of a white paper, and there has not been significant enough consensus. Well, I think, on my part, I think there's consensus, but our government does not necessarily take it as a priority. So they have not made it a provision of law to make sure that inclusive education in South Africa is realized. So given that, we have 3 different types of schools in a South African context. We have what they call ordinary public schools. We have inclusive schools. So this is where an ordinary public school has resource centers attached to it, which provide education for children with special educational needs. And then we have the third category, which are solely referred to as special schools. So this will be, for example, a school that solely caters to children with visual impairments, or a school that solely caters for children with a hearing impediment, and so on. So, but it's very specialized to the specific kind of disability in question. Given all of that, we were here when the COVID-19 pandemic took place. We know what happened there. So again, taken back, so during the lockdown, when education was moved to online platforms and media, no support services were provided for pupils with disabilities, their parents, or their caregivers. It is against this backdrop that us as the Center for Child Law took the Minister of Basic Education, then Minister Angie Motshekga, somebody else has now taken over, to court seeking the invalidation of the department's directives, which failed to provide guidelines for all categories of learners with disabilities, and did not cater to prepare hostels, which excluded certain categories of children. So in a South African context, again, there are very few schools that make provision for children with various disabilities, especially when you consider children with physical disabilities, intellectual disabilities, epilepsy, severe and profound intellectual disabilities, right? Very few schools provide services to those kinds of to children with those kinds of disabilities. And you would find that in a South African context, again, there may be 1, 2, or 3 schools in a province that cater to all the children with those kinds of disabilities within the province. So you have millions and millions and millions of children within the province, all attending the same school and some coming from outside. So what then happens is that attached to the special school, there is a hostel. Because again, you find that there's a child who would have to ordinarily travel 500 kilometers from where their family is based. And again, hence the argument for deinstitutionalization. Would have to travel some 500 kilometers from where their family is based to attend school in a different area. And this now meant that to ensure that education is made accessible to these children, then hostels would also have to be opened up and provision would have to be made. But what happened was that the Department of Basic Education failed to do that when they issued the directives on the return to school for learners. They hardly included children with disabilities, and it also shows because, I mean, we had back and forth engagements with them for some 2 to 3 months. Again, the issue of participation, they did not call on organizations for persons with disabilities so that they would be able to adequately understand what is needed and be able to put the necessary measures in place. So around the 30th of April 2020, when the Minister of Basic Education announced the plan for the reopening of schools following the COVID-19 pandemic, the mentioning of learners with disabilities was very symbolic because the department indicated that it was mindful of the needs of learners with disabilities and was working with provinces to ensure that special schools were adequately provided for, but did not provide any further details beyond the sentence I've just iterated to you. The published directions on the reopening of schools relayed measures to combat the spreading of COVID-19. The directives also provided information, including on aspects regarding the phased return of learners and educators, as well as different health and safety standards for which schools had to adhere in order for them to be reopened. Screening processes, the wearing of masks, the provision of sanitizers and disinfectants, social distancing, timetable models, curriculum trimming, and reorganization were the order of the day. The directions included a tabulated schedule for the return of learners with which differentiated between schools of skills. So schools of skills are trade schools, essentially, where people would learn how to be an electrician, for example, a hairdresser, and so on. Schools for learners with severe intellectual disabilities, and special care centers for learners with severe and profound intellectual disabilities. They did not outline any measures to protect learners with disabilities who were returning to school or the provision of support for those who remained at home, whereas children who did not have disabilities had such arrangements already integrated in the directions, right? The directions requested educators and officials. This is just one of the examples. So the directions requested the educators and officials of the school to wear masks without considering that the special needs of, for example, deaf learners who lip read and for whom cloth face masks would make it impossible for them to communicate were not really taken into consideration. Again, hence the need to actively participate and ensure that persons with disabilities, specific kinds of disabilities, are able to put their foot into that conversation so that we know exactly what is needed and the government is able to make those provisions. in fact, if you looked at the directives, there was a one-liner. So the directives were like a 7-page document, and there was a one-liner that said, arrange with schools to ensure that teaching and learning continues if learners remain at home, and that learners with disabilities will require specific support in certain cases in order to ensure this. See, it does not go into the nuts and bolts of what exactly does this mean in the context of children with disabilities. Also going back to specific kinds of disabilities, whereas the provisions for public for regular public schools were very, very specific about each and every nut and bolt of what it required. So the Center for Child Law, after engaging the department, so we engaged them, we found that, Sabiha, you'll have to hold me accountable for time because I have a tendency.
Thanks, Moya. Can you please wrap up in the next 2 to 3 minutes?
Fabulous. Okay. So as the Center for Child Law, I mean, we engaged with the department back and forth, back and forth, back and forth. I think there were 7 different communications back and forth with no real response from the department and no real plan from the department. We then took the matter as an urgent case, and we took it to the High Court, requesting that the Department of Basic Education amend those provisions. And in amending those provisions and the directives, they would part of the remedy that we sought was that they should publish those directives for us to be able to look at and comment on. So us and other people, other organizations for persons with disabilities, schools, everyone, to be able to look at and contribute to. And then once it's contributed to, the department has that obligation to actually look at those submissions, include them into the directives and publish directives, but again, within a 3-week period, because to us, it did not make sense that we should wait for another 6 months before children with disabilities are able to go back to school. So we took it to court on an urgent basis, and the court ordered that within a 3-week period of issuing that order, the directives have to be amended, and the guidelines have to include provisions for learners with physical disabilities, intellectual disabilities, epilepsy, and severe to profound intellectual disabilities. These are the categories of children that were previously excluded, and that the revised directives were to cater for the preparedness of hostels, to ensure that learners from these excluded categories are able to receive an education on par. And again, you see this is an equitable measure that other children don't necessarily require, but in this particular case, it's absolutely necessary. So as part of the order, the respondent was expected to ensure that the draft amended directives and guidelines were made available to the public for comment and for a period of 10 days, I think, and that the department had to take those comments into account before issuing final amended directives and guidelines, all within a period of 6 weeks from that order. So again, that through that process, we're able to actually make certain pushes in terms of provision for education for children with disabilities in general, but also for the provision of infrastructure in particular. And this now goes back to the first case that I talked about on Western Cape Forum for Intellectual Disability, where it was determined that yes, basic education is a right for all children, including children with disabilities. Because again, within the context of COVID-19, the argument was, well, there's not enough space in the school. A lot of kids will have to be removed from the school for them to be able to study safely. And again, that is a failure of the state to make provision in failing to make provision for infrastructure. It is not something that the students must then suffer for. So in that same context, mobile classes and all of those kinds of provisions were made available to schools. And as part of our monitoring and evaluation, as I said, one of my first tasks here was to actually call the affected schools and ask the school principals and staff as to the effectiveness of those measures. And then we further engaged with the department in that regard to ensure that each school was able to get the kind of assistance or the kind of interventions that they specifically required. So that's that on that from me. Thank you.
Thank you so much, Moya Habo. And thank you as well for highlighting, just the lack of political will, I would say. Whenever a tragedy happens or, any situation a humanitarian emergency, a climate crisis, whatever it may be. And states just do not consider persons with disabilities in any of those relief measures. So thank you so much. So that brings us almost to the end of our webinar, but I would now like to call upon my colleague, Richa Sharma from Transforming Communities for Inclusion to announce the date of our next webinar. Richa, if you're still with us, can you please go ahead and announce the next webinar?
Yes. Hi. Hello,
Hi,
everyone.
Richa.
Hi, Sabiha. Yeah,
Yes, please go ahead. Thank you.
sure. Thank you for that, Sabiha. Hello, everyone. My name is Richa, and I'm the Research and Advocacy Officer at TCI Global. We are a membership-based organization of persons with psychosocial disabilities and are also a member of the Global Coalition on Deinstitutionalization. First off, I would like to thank all the speakers for the amazing discussion and the presentations they made today. And big thanks to the Center for Human Rights at University of Pretoria to organize and arrange this great panel. And congratulations for forging ahead successfully in spite of the terrible disruptions. I'm here to announce that TCI Global, along with the support of the Global Coalition, will be organizing the next webinar in this series. It will be held in the month of September 2024 and will cover the Chapter 7 of the DI guidelines on access to mainstream services on an equal basis with others. We don't have the dates as yet, but we will share further information on the webinar, including the final date, the agenda, soon with you all. And we will disseminate this information with everyone who registered and is here for the webinar today, along with putting the information on our website and social media handles. So we look forward to seeing you all for the next webinar as well. With that, I hand it back to Sabiha. Thank you.
Okay, thank you so much, Richa. We will now have a Q&A session. Unfortunately, we do not have a lot of time, so I'm going to keep this at about 8 minutes. I would now like to hand over to my colleague, Dragana Sedic Milovanovic from Disability Rights International, who will be moderating the Q&A discussion. Thank you, Dragana. Great. So if anyone has a question, please feel free to type that in the chat or in the Q&A box. Jagna, please go ahead. Thank you.
Yes, thank you very much, Sabiha. Good afternoon, everyone. My name is Dragana Ciric, and I'm Inclusive Development Advisor at Disability Rights International, which is an advocacy organization for persons with children and adults with disabilities, advocating for their full community inclusion. And we're also part of the Global Coalition on Deinstitutionalization. I will moderate today's discussion, and we already have a few comments and a question in the Q&A box from Joao. I hope I'm pronouncing your name correctly. So the question is addressed to Fatima. What was understood as deinstitutionalization by Gauteng government. There was, of course, a comment that what took place was not really deinstitutionalization, but rather trans-institutionalization of children. And the issue was more about really the neglect and treatment of people who were detained in these institutions. They're not humans, it's just they were moved like things around rather than really there was any attempt to include them in the community. So whether we can treat this as an attempt of deinstitutionalization at all. So I would hang over maybe to Fatima if she's here. as to whether there was at all intention of the government to deinstitutionalize and whether that was ascertained or not. Also, I would like to give maybe opportunity to Joao to come in if that's an option. Thank you.
Hi, sorry, I was just struggling to unmute. In terms of the question, is it specific to this case specifically?
Yes, it was about this specific case.
Okay, so I obviously would require more facts to the case specifically, but I think you could look at it as a case of deinstitutionalization. Yeah, I'm sorry, I'm unable to, I just need a bit more of the facts of the case to understand if it falls under deinstitutionalization or not.
Sorry, Fatima, I think you might have misunderstood the question. Joao was asking specifically with regards to Life Esidimeni and what exactly was the Gauteng government's thoughts or the thought process behind it, because it doesn't actually constitute deinstitutionalization, but more trans-institutionalization, which is just moving them from one institution to another. Yeah, so the question was specifically on, you know, what was the Gauteng government's sort of thought process behind it?
Oh, sorry. Yes, I did completely misunderstand. I'm sorry about that. Yes, so the Gauteng Department of Health in this case, used this case as an excuse for deinstitutionalization, stating that Life Esidimeni was too costly and these chronic patients were kept in an institution like Life Esidimeni for too long and needed to be rehabilitated into community-based organizations. The shift to community-based organizations was an excuse for deinstitutionalization because these community-based organizations were not equipped for rehabilitation of any kind. It didn't have the facilities for rehabilitation. It didn't have the facilities to ensure that the basic needs of these patients would be met. It was also they used deinstitutionalization as an excuse for cost cutting, stating that by putting these patients into community-based organizations would be cheaper on the department and better for the families, but no families were consulted. Experts warned against the shift because you cannot move 2,000 patients in the span of a few months. Yes, I think it does classify as deinstitutionalization, as this was what they looked at. The Gauteng Health Department called it deinstitutionalization based on the Mental Health Act and framework. But obviously this was just complete chaos and resulted in a tragedy at the highest level.
Thank you very much, Fatima, for providing further information. As the guidelines on the institutionalization state, this can certainly not be considered the institutionalization, because the institutionalization really encompasses access to services, among else, and should not be, there is explicit mention that this cannot be used as any cost-cutting measure or similar excuses for simply transferring people from one facility to another. Thank you for this question, Joao. We have another question from Abikar Bashir. In the context of emergency deinstitutionalization during humanitarian crisis and conflicts, what are the most effective strategies for ensuring that persons with disabilities are not only safely evacuated, but also integrated into community-based support systems? Additionally, how can we address the specific challenges of accessibility and inclusion in these community settings to ensure that their needs are fully met. Would anyone from the colleagues like to come in and to address these questions? Fortunately, I can't see.
Dragana, Lisbeth's hand is up.
Thank you.
Lisbeth, please go ahead.
I can respond to this question. We had a list of recommendations, for example, for the case of Acapulco, that I think can be used also for other humanitarian emergencies. The first thing is to recognize the crisis. For example, if the impact of climate change on people with disabilities, or the impact of the war on people with disabilities, for example, to immediately identify the number of public and private facilities and the number of people with disabilities detained in institutions, and what are the conditions they're living. Also identify if there are displaced of people with disabilities, unaccompanied children with disabilities separated from their families, include deinstitutionalization and national emergency protocols for people with disabilities, accelerate the deinstitutionalization processes for people with disabilities, especially in emergencies. Do not use any type of resource, including those to intend to the emergencies, to rebuild and repopulate institutions. I think this is a key element to change the perspective and the way we're addressing conflicts or emergencies. Ensure that humanitarian assistance is distributed in accessible and non-discriminatory manners. For example, we saw in Acapulco that people was waiting for receiving resources for about 2 days, line up with the rest of the people. They were not priorities for receiving support as the rest of the community. They were just waiting for days. Creating housing alternatives for those vulnerable populations and those who lose their house. If we don't support housing, they will end up in institutions. And the last, and I think very important, is to include the participation of people with disabilities in all actions to reconstruct the cities, and instead of segregating their participation. Thank you.
Thank you. Thank you very much, Lisbeth, for sharing these recommendations. I assume that we are reaching the time limit that we are allowed to. Do we have any more time for additional comment? I think there is one comment added by Joao in the chat box. That deinstitutionalization was clearly only an excuse in this case of Gauteng government, and that to send people treated one way and with certain condition in one place to poorer conditions. Yes, exactly. That instead of transferring people from one institution to many small institutions, which we see as a general tendency among governments, people should be reintegrated either back with their families or found an accommodation in the community and treatment in the community. And many people with mental health issues are taking as patients only because they may need some medication that is sad and inhuman. And I think that really sums up the overall approach to persons with disabilities, especially persons with psychosocial disabilities, by the government, and that is clearly emphasized in the guidelines as well. I think Fatma did include really, she did highlight the issue of stigma and the need to reduce stigma and to actually present this as a basic human right of all people to live in the community and be included in society. Sabiha, over to you.
Okay, thank you so much, Dragana. This brings us to the end of our webinar. I would just like to once again apologize for the interruptions that we had earlier on. Unfortunately, it seems our webinar was hacked, but I'm very happy that we got that under control and everything else went off really well. Just in closing, I would like to say thank you to all of you for attending today. A special thank you to all of our speakers. A special thank you to our interpreters. You really help us in making these webinars accessible to all of our participants. Thank you as well to Simpiwe, my colleague at the center, and my colleagues from the Global Coalition on Deinstitutionalization for all of the support. And yes, as Richa mentioned, we will definitely be sharing the details on our next webinar. Thank you so much once again, and goodbye, everyone. Thank you.